There are certain tick fevers which are transmitted in just 3 to 6 hours after attachment. Today I am taking you through two topics. One is tick fever management in dogs and the other is nutrition and food habits in dogs. I am Dr. Vinod Kumar, Director and Chief Consultant of Malabar Pet Clinic, Kozhikode, Kerala State. Out of my 30 years of experience, I have seen lot. I cannot even count the number of tick fevers which I have gone through. See, there are three types of ectoparasites on the body: ticks, fleas, and louse. Ticks only produce this tick fever. Fleas are not producing any tick fever, but fleas actually they will just bite and they will produce a sort of flea allergy. And louse, they won't produce any disease at all, but they all produce, they bite and chew, producing certain allergies. But the tick infestation, we technically term it as acariosis. Acariosis is very dangerous and always it should be controlled. Even coming to the ticks, their life cycle is on the body as well as outside the body. There are a lot of tick fevers. What is a tick fever? A disease which is being transmitted by a tick. And this is highly dangerous because it is much affecting the immune system as well as it destroys all the systems of the body. On the dog, there is a special tick known as Ripicephalus sanguinis. It is the most dangerous tick which can produce dangerous tick fevers. And here the tick fevers, they come under several categories, like in the dog or the cat. In the dogs, there are certain tick fevers which are very dangerous and which are not at all dangerous. Let us come from the dangerous tick fevers. The first thing which is our major concern is babesiosis. There are two tick fevers coming under babesiosis, like the Babesia canis, which is a protozoa which is found inside the red blood corpuscle, and also the Babesia gibsoni, which is again found inside the red blood corpuscle. In turn, they can destroy the red blood corpuscle and produce profound anemia. And also it can destroy the immune system so that it is vulnerable to other diseases. This tick fever has to be diagnosed at the earlier stage itself. First, let us come to Babesia canis. It is one of the major concerns by which a drug known as imidocarb can be successfully used. The next is Babesia gibsoni, where a drug known as berenil can be successfully used. So there are certain drugs which can be used against babesiosis, whether it is canis or gibsoni. But the problem with these drugs is we can suppress these organisms and they will become inactive and they will go and hide inside the cells. But with these drugs, we cannot mostly kill these organisms. For killing these organisms, there are certain other drugs which are very expensive, like atovaquone, artesunate, etc. When should you suspect that your pet is having tick fever? Number one, it is having fever. Definitely it will be having fever. Number two, there is swelling of one or more limbs. Number three, there can be nasal bleeding. Nasal bleeding is technically termed as epistaxis. Number four, there can be blood in stools. Number five, there can be lethargy. Number six, there can be blood in urine. Number seven, there can be bloody spots or red spots on the skin. Number eight, there can be swollen abdomen, like there can be a swollen spleen. And these are the commonest symptoms which we can observe by a clinician or even by the pet parent. The pet parent, in fact, other than this splenic enlargement, etc., the pet parent can themselves appreciate by just examining. The pet may be highly lethargic, weak, and the pet may be anemic. Anemia means blood loss. There may be blood loss and the patient may be highly weak, may not be eating at all, they may not be drinking at all, they may be lethargic all the time. So, it should be immediately taken to a pet clinician, and the pet clinician, from the very first clinical examination itself, he can judge that it can be a tick fever. There are certain diagnostic methods which can be employed, simple diagnostic methods, by physical examination, by blood examination. Then we can go for specific tests like PCR or blood smear examination, etc. By this, whatever this be the sort of examination, we can diagnose it as well and we can undertake the treatment. Like as I told earlier, Babesia canis or Babesia gibsoni or Ehrlichia or Anaplasma or Hepatosune, whatever be the tick fever, it can be distinguished. There are certain differential diagnoses and each disease has their own clinical presentation. Like there is a disease known as cyclic thrombocytopenia. Cyclic thrombocytopenia means cyclically there will be diminishing platelet count. So in such cases, it can be a result of anaplasmosis. So it can be taken as a chronic anaplasmosis, and in such conditions, treatment can be adopted against anaplasmosis. Another thing is hepatozoonosis. This is also very commonly found. Then Ehrlichiosis. For Ehrlichiosis, there was no treatment earlier. During when in 1995-96, there were no treatment at all. Then newer drugs came into existence, like doxycycline injection. So doxycycline was a safe drug, and still doxycycline is a very safe drug. But while administration of doxycycline, we should be very well aware that it is very dangerous for the cat if given in empty stomach. So it should be kept in mind that when doxycycline is given to the cat, it should be given only with food or after food. Even in dogs, we always recommend it should be given with food or after food. And it is highly dose specific, but one advantage of doxycycline is that it is not passing through the kidneys. Kidneys are not excreting the doxycycline, and so kidneys can be spared, and even slightly higher doses of doxycycline will not produce any side effect. But it is chiefly excreted through the liver, and so we will have to monitor the liver function very frequently. As such, don't be afraid of these tick fevers. Tick fevers have their own, in their capacities, they can be solved very well. There are a lot of drugs available against tick fever, right from least expensive drugs up to highly incredibly expensive drugs. So there are good treatments against tick fever, but the accurate diagnosis is the most important part in managing a tick fever. Along with tick fever, we have to adopt certain measures to control ticks also. So ticks, almost in India, in our country, most of the ticks are infected. All these organisms are harboring either in the mouth parts or the salivary glands of the ticks. And so when they are biting, they can suck the blood, and at the same time they can introduce these organisms. They can multiply inside the blood of the host, and then they can produce a disease. And so eradication of ticks is very important. A lot of medicines are available as shampoos, injections, oral medicines, spot-ons, sprays, powders. Lot of medicines are available. So according to the need, we can select the medicine, we can apply the medicine, and anyhow the ticks has to be eradicated. Otherwise, this will reoccur. And reoccurrence of tick fever is very common. Once we adopt a treatment, it doesn't mean that treatment is for lifelong. Whenever a bite from an infected tick occurs again, the disease can occur. We should be very much aware of eradication of ticks. And so tick eradication is a big process, and this is a crucial part in control of tick fevers, not only the treatment. Always think that prevention is better than cure. Canine nutrition in the dog or feeding the dog, that is not a complex process. As we all know, dogs are carnivorous animals. Strictly carnivorous, we can say, because their ancestors are still in the carnivorous nature inside the jungles. So they are carnivorous. But as when they became our friends, true friends or companions, they slowly developed some changes in their gut, like the length of their gut has changed. It has been manipulated or changed in such a way that it can digest some amount of starch, like what we have the starchy foods like rice. Earlier, there was no capacity of the intestines of the stomach to digest starch, and nowadays they can digest starch also. Protein requirement is the most important in a canine nutrition based calculation. They are carnivores, and for their development or maintenance, they need protein as a source of energy. As we need, the best source of energy is carbohydrate. But in the dog, the best source of energy which we can consider is a protein. Or roughly we can say the protein requirement of a dog is 2 gram per kg per day. So all the foods what we give for the dog depends on how much of protein it has. For example, beef, they have 18% protein. Mutton, it has 18% protein. A whole egg contains 6.3 grams of protein. The white of the egg contains 4 grams of protein. The rice, it doesn't contain any protein. So that is why we say always give proteinaceous food for the dog. And we can give these protein foods in a certain proportion. Like for the adult, we need to give only 18% protein. That means 18 gram of protein per 100 gram of food. That is what all the companies who manufacture pet foods do. And a growing dog should have 24% protein in their diet. Suppose it is a dachshund having 10 kg body weight. What is the protein requirement? What is the requirement of food per day? The food should contain 2 gram per kg protein. So the requirement of protein here is 2 into 10. That is 20 grams of protein. From where we will get this 20 grams of protein? 100 grams of beef will contain 18 grams of protein. We need 20 grams. So actually for this 10 kilogram weighing dog, we need only 100 grams of beef or meat, which will contain 18% protein. See, that is a rough calculation. Likewise, if you elaborate these calculations, we can accurately calculate how much of beef, how much of meat, how much of fish, how much of protein, how much of egg, how much of rice, how much of wheat can be given to dogs. And another thing is regarding the gut health. It's also very important. See, the gut, it starts from the mouth to the anus. That is the entire length of the alimentary canal. Throughout the entire length of alimentary canal, there are certain beneficial bacteria which are adhering to the mucous membranes. This is known as the gut flora. This gut flora is essential for any type of digestion. Protein digestion, mineral digestion, carbohydrate digestion, or fat digestion, or vitamin digestion, whatever it is, this gut flora is needed. Without a gut flora, this whole gut, that is the whole alimentary canal, becomes inactive. So gut flora maintenance or health of the gut flora is very, very, very important. Always when a dog is going inappetent, it is not eating anything, we will have to think of the inactive gut flora. For that, certain medications have to be given which enhances or stimulates the gut flora. The drugs which we choose should contain 3 elements like the prebiotics, probiotics and the polyphenols. All the commonly used or the commonly available pet foods or gut enhancement or activators contain mostly prebiotics and probiotics. When it is enhanced by polyphenols, it becomes more effective. I always recommend the combination of these prebiotics, probiotics and polyphenols should be given to dogs, which enhances the gut health. One example that I can think of is Godrej Ninja, which have a unique combination of probiotics, prebiotics and polyphenols. And it enhances the gut flora unlike any other product which has probiotic and prebiotic alone. We are assuring that the addition of polyphenol enhances the gut flora very well. So this type of combinations can be given to enhance the gut health of the dog. Thereby the digestibility is improved, the appetite is improved, and so the assimilation and the growth is also improved, especially in young dogs where this flora disturbance is very common. We have to always be concerned about the gut health, the protein requirement, the fat requirement. The fat requirement of the dog is 1 milligram per kg per day. The carbohydrate requirement of the dog is 20%. In some pet foods, they add almost 30%. Or in some pet foods, they even add up to 60%. Of course, they can tolerate to a certain extent. But always when we are using more carbohydrate, there is every chance of fermentation, and so gut health has to be maintained. As I said earlier, for maintaining the gut health, this combination of 3 elements is essential: the probiotic, prebiotic and polyphenol.